ready, set, go! Is that fun? Oh, what fun. Now what? Back to the swing. Gianna was born 24 weeks and 14 ounces was her weight. So I was 4 months early. And basically what happened, you know, we tried for a long time, so when we found out that we were pregnant, we were very happy. And early on, I thought something might have been wrong because I didn't quite feel pregnant. I didn't get as big as I should have been for that period. I kept asking the doctor. He kept telling me there was nothing wrong, and there was no signs of anything. I didn't have swelling. I didn't have, you know, all the signs that you have with, you know, what I wound up having, which was preeclampsia. So at my 6-month appointment, I went into the doctors and they told me that my blood pressure was 185 over 90. And suddenly, because I was there, you know, you go every month. So I went at 5 months, everything was fine. A little bit of swelling in the ankles, not a big deal. I said, listen, I don't feel the baby kicking. He's like, that's okay, it's the first time you've been pregnant, okay. So I was a little worried. I just thought something was off. So when they told me my blood pressure was that high, and they said, let's check it again in a few minutes, you just got here, maybe you're nervous. So they took it again and it was higher. So they said, you need to go to the hospital, everything hopefully will be fine. Hopefully it's just going to be a passing moment and you'll be fine. So I go to the hospital, the local hospital, and they hooked me up to blood pressure equipment, and it just kept going higher and higher. And the nurses are looking at me like, why are you still sitting here breathing? I mean, it was 190 over, like 193 over 102, right. 105, really high. So at that point, they started telling me they were going to give me magnesium because that helps, prevents a seizure, I believe. So I was nervous because I didn't feel confident with this local hospital. I don't care for this hospital and didn't know if it was the right thing. There wasn't an OBGYN there. These people weren't doctors. And they're telling me they're going to give me this drug and it's okay. You're going to feel sleepy. Don't worry about it. Okay, so then a while later, the OBGYN that was on call, because it was late at night by then, she came into the hospital. And I had never met her because it's a group of doctors at my OBGYN, so I had never met her before. And she said to me, do you know what preeclampsia is? I said, yeah, I've read about it in my book. She said, well, that's what we believe you have. And since it's going up and up, we need to give you medication. We're going to give you the magnesium drip. And we need to get you to a hospital where you can deliver a preemie this small and this early that they can handle. And my reaction to that was, I'm 6 months pregnant. Like, you can't possibly deliver a baby at 6 months. She says, well, believe it or not, you know, they can do amazing things nowadays with preemies. And, you know, you're 6 months, but if you're above a pound, they really can do amazing things now. But we need to get you to a hospital that has a level 3 NICU. And we don't have that here. So you have a choice of Lehigh Valley Hospital or Abington. And I don't know anything about Lehigh Valley, and I know Abington's a wonderful hospital, so I said, please try to get me to Abington. And we had to wait a couple of hours before they admitted us because the NICU was so full. So finally she came in and she said, okay, I heard back from the doctors. They have a bed open. They have room for you, and we can take you there. So they, you know, and I was beside myself in terror. I mean, I thought, a pound? Are you kidding me? 6 months? How can a baby survive at 6 months? And the only thing that I really knew about premature babies was I worked with someone who had a 3-pound baby, and I remember that she was there for months and months and how difficult that was. So I thought, a pound? You know, I mean, I can't even imagine. So they sent me to Abington by ambulance.
All of a sudden you're thrust into this traumatic situation within hours. And now you're going to have to give birth to a premature child. And it isn't like you know anything about that. You know, while you're pregnant, you're not going to read about all the complications that may occur if you have a premature baby, in this case an extremely premature baby. You're just not prepared for that. So you're going from a normal situation into a very hard situation, an emergency, really. And Tina herself was, her blood pressure being so high, they're trying to stabilize her, keep the baby from being born for as long as possible, but not at the risk of having Tina suffer complications. Like I said, this is all within a matter of hours.
Sing it louder. Can you do it louder? Is there a party in your tummy?
Yeah. Yeah.
It was really scary because I was on the verge of having seizures. I mean, your blood pressure's that high. They couldn't get it down. They stabilized it, but they couldn't get it down. Then they do an ultrasound. They come back. We think the baby's a pound. And they give me the ultrasound picture, the strip, and it's hanging on this machine that's hooked to my stomach that's got the baby's heartbeat on a speaker system. I was concerned about the baby because I thought a pound. They started to give me steroids for the lungs in preparation to deliver this baby. So, and at that point, I guess the doctors didn't really know how long I was gonna be able to stay pregnant, and they sent the neonatologist in, Dr. Moonjin. He came in and gave us the speech that I guess they give all parents who aren't prepared for this. Like he said, we got thrust into this situation, had no clue what was going on. And he gave us a speech, told us that if the baby's around a pound, which they're hoping it is, we have a very high chance of not surviving past a day. If she does survive, the chances of her having very long-term, brain bleeding, cerebral palsy are very high. I don't know the statistics, but they were above 50%. I mean, it was like 80% chance that the child wouldn't make it.
Yeah, it's a very real discussion.
It's like,
if you have this child, here's the percentage
here's
or
what you may
probability
have.
that this, that, and the other may occur. It's a preparation. It's very, it's a very strong preparation, but it's realistic as to what may occur, this early in giving birth.
So this is your decision, and if you're not prepared to handle this, then you need to make that decision. It's up to you. And I said to him, no way, we have to do this regardless of what the outcome is, because we might not have another chance. What's a tap shoe? Oh. Okay.
Capsule.
Is that a capsule? So,
It is?
down to the operating room, and when they weighed Gianna when she came out, they came over to me, Dr. Cleary came over to me and he said, your baby is 14 ounces, not a pound and 3 ounces that we thought. So the risks are even higher. They're extremely higher now that she's less than a pound. The percentages of survival go way down at this weight. So
They immediately had to get her on a ventilator. And at the point of birth, the issue was, did they have a tube small enough to get into her lungs?
and Dr. Cleary said to us, what do you want to do?
Right,
And
so at that point, you make a decision, because she was on the edge of viability. So we decided that we wanted to have her ventilated, and he was going to give it his best shot. He found the smallest possible tube you can possibly have in a hospital to stick into a baby's mouth and into their lungs. And even then, it was just it was a crapshoot as to whether it would work or not. So he went over and did it and came back and told us that it was successful, and she was hooked up to the oxygen. And at that point, really, that would be kind of the point where you really begin your NICU journey.
Yeah, and he said it wasn't easy. He said, but you know what? She's kicking, that little feisty daughter of yours, remember? He said her little teeny tiny arms and legs are kicking like crazy. Say, help please.
Help please.
Help please.
Help please. Help please.
You on?
Yeah.
Okay. Ready? Set. Go!
In it out. In it out.
Out. And she looked like a chicken.
Right.
She looked like a spring chicken.
Yeah.
Her feet were this big. Literally. Her arms were, her skin's just, Yeah, it's
And once we got into the NICU, and Tina got a room, because she was going to be in a hospital for a couple weeks as well, trying to stabilize the issues that she had. And they put the baby in a NICU. Neither one of us had ever been in a NICU, had maybe seen premature babies in pictures. When you first go into the room, it's quite an eye-opener. You're just not used to seeing babies that small and that tiny. You're not used to seeing them on oxygen, just surrounded by all kinds of medical machinery. It's not the way you typically see a baby. You're looking at a fetus outside the womb, and it's not really like looking at an infant, because really that's what you're seeing. You're seeing, 20, in Gianna's case, a 24-weeker, but there's 26-weekers, 28-weekers, and you're not seeing a fully developed newborn. You're seeing what appears visually to be a fetus outside. And that was the first shock of not, all the notions you had of what it'd be like to see a baby for the first time, and you're not seeing that. You're seeing something completely different. And, it really tugs at your heart, too, so.
And when we went into the NICU, I was in a wheelchair. They wheeled me into the room, and I'm passing these babies, and I'm thinking, that's not so bad. Because some of the babies in there are 3-4 pounds. And I'm like, okay. Because you forget that quick. Like, they show you the baby, and then they take them. So it's like, and they wheeled me up to, she was on a warming table, not yet in an incubator, and covered by this tent. Remember that paper mache type tent?
Right. Under special lighting because of the skin.
Special lighting, not in an incubator yet. And the lady that was handling her was just amazing. And she said to me, "She looks good." I'm looking at her like, are you kidding me? She looks like a chicken. That's not a baby. 10.5 inches long. So, and bright red, because the skin is see-through. You're at the stage where your skin hasn't thickened. So you can see the blood vessels and everything right through the skin.
Almost translucent.
And it's just, it doesn't look at all like a baby. And they just said, "Hi, Mom." What's the matter? What's the matter? You want to go down? You want to go up the side? I bet
The first few weeks, maybe the first few months, really the whole time you're there, you're really just looking for little benchmarks that they hit, small things, kicking the legs, moving the head. If they had a good day just on the oxygen, there was good days, bad days. They tell you ahead of time it's a roller coaster, and it really is. It's an emotional roller coaster, and it's a day-by-day thing.
And they tell you they're going to call you if something happens. So the doctor came walking into the room. A couple hours later, I'm a mess because I've got hormones and I've got high blood pressure and a 14-ounce baby and separation anxiety because you can't hold your baby. So doctor comes into the room and I'm like, oh no, here we go. He says, "You know what? She looks really good. She's in an incubator. You want to go visit her? You can go visit her. She looks pretty good. I can't promise anything, but she looks pretty good." So I go back down to the NICU, and they start telling us what the machines are and what they do. And I'm not a medical person. I don't have any medical background. And they explained to me what blood oxidation meant and what the ventilator settings meant. And there's like lots of dials on there, and there's, pressure settings and all kinds of settings on this machine. And I'm looking at these nurses like, how on earth do you know how to use this? I mean, these were the women. The doctors come with critical points. And in the very beginning, the doctors were there a lot. But for the most part, those nurses are incredible. And not only are they dealing with keeping a baby alive, they're also handling the emotional stress that I'm going through. And they're like best friends. As soon as you walk in there, these people are like hugging you, and because you stand there and you're just crying, looking at this little tiny baby trying to survive, trying to breathe, fighting, and it's really.
And when you're in that
really
situation, you want to know what's happening with everything as far as the medical equipment. So, like Tina says, you become, every day you're getting educated on something new.
As a parent, I think it's your obligation to your child to learn as much as you can, because what happened in our instance is we wound up coming home with lots of issues. oxygen, feeding machines, nurses in our house. And if I didn't know what I was doing, we wouldn't have had the success we had with this child. So when you're there at the NICU, you have to just get as much information as you possibly can from those people that are there. They said to me, you can probably hold her in a week, which is like the greatest thing in the world. And when I took her out to hold her, it was a production. It was like 4 nurses, you know, there's tubes, there's all kinds of tape involved. They have to take the child very, very slowly, gradually onto my chest. Don't make any movements, don't make any sudden noises. Everything needs to be very quiet and calming because the child's supposed to be in your uterus still. So does Goofy like that ride?
Yeah.
Yeah? I think it's just a really big part of the child doing well and getting better is the love that they get from their parents. So holding them is so, so important. So even though it takes an hour, you know, to get the child in and out of the incubator, I think it's so important that they feel that love. I think it took her 3 weeks to reach 1 pound, and then she would gain about 1 pound a month. So when she left the hospital after 6 months, she was 6 pounds.
She was the weight of an
Typical
average
newborn.
newborn after 6 months.
And she was 2 months, this was 2 months after I was due. So now, you know, and at this point, 6 months, you just want to take your baby home. Like, I know I'm going to have equipment, but please just let me out of here, you know? So, and at this point, they started to bring in, you know, they do the developmental care all along. They move their head from side to side, you know, every night so that you don't get that flat preemie head. You know, they learn this, I guess, over time. They're starting to learn a lot more about it so that the bone structure, because it's so soft, doesn't get squished. So they move them on their, you know, their heads around a lot. They started putting pictures inside the incubator. All that developmental care is very important for their brain growth because, you know, let's face it, they're not supposed to be outside the womb at that early stage. So trying to help them, you know, make the connections in their brain that need to happen. And, you know, then they started bringing in, they said, can you bring in your mobile? Because we've never had a child here this long. She's 6 months old. She needs to be looking, her eye-hand coordination needs to start happening. So she's like 2 months past the due date now. So she's like a 2-month-old, really. You need a mobile. So I brought the mobile in. I bought a swing in the NICU. It's a slow uphill battle in the NICU. The growth is small. You just want to get out of there. You want everything to happen quickly, and it doesn't. It happens very slow. It's a lot of work, but she's amazing. She is just a typical 3-year-old child. So we just hope that you know, this information is helpful. It's very scary to walk into the NICU. It's very scary to be thrust into, you have a premature baby.
You learn to appreciate it that much more. The little things, the bigger things, the milestones. You just learn to appreciate it that much more because you saw the struggle that your child went through, and it gives it that much more meaning.
Is that for great, Gianna?
Kisses.
So this is the 14-ounce miracle baby that we're so proud of. Right, sweetie? Are you a happy girl? Are you a happy girl?
Yeah.
Are you happy?